Hi, thank you so much for the people who have stuck around this long. I hope we'll make it worth your while. I really look forward to sharing some of this research. I'm Philippe Lucas. I'm VP of Global Patient Research and Access at Tilray. And as part of my roles at Tilray, I oversee our patient services department. I look for ways to expand access to patients, but I'm also an active medical cannabis researcher. So today I'm going to share a little bit of data that we gathered on First Nation patient patterns of use of medical cannabis. There we go. I've already done my introduction to Tilray, so I'm going to skip right over and tell you a little bit about our research projects right now. Tilray is a leader in medical cannabis research. Right now, we've got 5 clinical trials underway, one of them on chemotherapy-induced nausea and vomiting. That's taking place in Australia. It's a relationship with the government in New South Wales. And we've just finished a study of pediatric epilepsy at Sick Kids Hospital, which is the premier children's hospital in Canada. We saw some really remarkable results of using high CBD products for the treatment of seizure disorder. We have an ongoing study of post-traumatic stress disorder. It's a phase 2 clinical trial that's at the University of British Columbia. And we're going to be announcing the launch of a second site in downtown Vancouver as part of that clinical trial, which is the largest medical cannabis clinical trial to take place in Canada in at least the last 40 years. We've finished a study of COPD at McGill University, and recently we announced a study of essential tremors that's taking place at the University of California, San Diego, and it's the first time that medical cannabis is going to be exported from Canada into the US for use in a clinical trial. We are also really interested in studying cancer, anxiety, alcoholism, HIV/AIDS, and pain, and we're going to be announcing clinical trials on those indications in the coming months. Oh, there we go. So as an active medical cannabis researcher, I'm involved in a number of studies, and these are all studies of which I'm the primary investigator. Today I'm going to be sharing data from the Tilray Patient Survey, which is the largest survey of Canadian patients that's been conducted to date. We did this data gathering in January 2017, and we gathered responses from 2,032 patients from across Canada. I'm really excited to share some of this data, and what I've done is done a sub-analysis of First Nations participants in that study, but we're going to be launching the 2019 version of this survey in January of this year. We actually expect to get between 8,000 and 10,000 responses at that point. So I'll look forward to maybe coming back here next year if this conference is on again and sharing the results of that study as well. We've also got the Tilray Observational Patient Survey, which is a longitudinal tracking of medical cannabis patients looking at the impact of medical cannabis on quality of life and on prescription drug use. And recently we started a study called the Substitution of Opioid Study, which is looking at the impact of medical cannabis on Suboxone and Methadone treatment to see if medical cannabis can improve the treatment success rate as measured by retention and adherence for patients who are going through Methadone Suboxone treatment for opioid use disorder. I don't need to tell anyone in this room, I'm sure, that we're in the middle of an opioid overdose crisis in Canada, in North America, and more around the world. And there's ample evidence now that cannabis can play a role in reducing the impact of opioids on individuals and on public health as a whole. And a few weeks ago, I got ethics approval to start the medical cannabis in older patient study, which is going to be tracking medical cannabis in patients over 50, which is one of the fastest growing segments of the medical cannabis program in Canada. And yet we know very little about how seniors are using medical cannabis. So I'm really excited to get that study going as well. We're going to be launching it in Ontario shortly. This is a quick look at the Tilray Patient Survey, just to give you a sense of what it is that we were doing here. It was a 239 question survey. It was available in French and English. We sent it out to all Tilray patients at the time, which was 16,000 patients across Canada, and we deliberately cut off the survey at 2,000 respondents because we're giving all respondents a $10 credit for filling out the survey, and we only had a $20,000 budget for the study. As a result of that, because people were midstream, we had 2,032 full responses. Now, the average age of these patients is 40 years old. And I think that breaks down some of the stereotypes about who's using medical cannabis out there. I think there's still a public perception that medical cannabis is being used by 20-year-old guys sitting in a basement doing bong hits and getting a doctor to fill out a script for them. And in 20 years of working with medical cannabis patients, I see something quite different. What I've seen is middle-aged individuals who have treatment failures using traditional pharmaceuticals who are looking for alternatives. And certainly when you see that the average age of these patients is 40 years old, you can see that that seems to be who's using medical cannabis here. Now, you do see more men than women using medical cannabis, so 62% of respondents were men. But the good news is when I did this survey in 2015, only 25% of respondents were women. So at this pace, within the next couple of years, we're actually going to see gender parity in the Health Canada medical cannabis program. And one of the reasons that more and more women are starting to consider the use of medical cannabis is there's a number of conditions with a higher prevalence in women, like fibromyalgia, lupus, anxiety, depression, migraines, that don't respond well to traditional pharmaceuticals, but that do seem to respond well to medical cannabis. Now, this is a highly educated patient population. So it's worth mentioning this, once again, to break down some of the stereotypes around medical cannabis. 93% of participants have a high school degree or higher compared to 87% of the Canadian population, and 22% have a university degree. So in general, medical cannabis patients are more educated. And the incomes of these patients is about the same as the general population in Canada when we're just looking at all the participants here at all. In fact, in general, medical cannabis patients tend to be higher educated, a little bit higher income than the general population, and often a little bit better looking than the general population. So that last part is totally subjective, but I stand by it. It's a totally fair assessment. Now, I wanted to show you this because I wanted to show you the same slide when it comes to First Nations populations and Métis populations. So 6% of respondents in this survey self-identified as Métis or First Nations. So on some of these slides, I'm going to break out those populations so we can see the difference of First Nations Métis experiences using medical cannabis compared to the general population. And what you see here is, on average, Métis First Nations are lower income than the general patient population, and a full 73% highlight that affordability is an obstacle to access. So as I spoke, earlier on a panel, I think that this really highlights the need for cost coverage for medical cannabis patients who are First Nations or who are part of Métis Nation as well, because they seem to have greater obstacles to access in terms of affordability than the general population. And this is the most temperamental clicker I've ever worked with. There we go. In terms of, there we go. In terms of primary conditions, I always ask the same two questions when I do this kind of survey. What's your primary condition? And you only get to check one box. What's the main reason you talk to your doctor about using medical cannabis? And then I ask patients, what are your primary symptoms? And at symptoms, you get to check multiple boxes. So the way that plays out is a patient that identifies MS as their primary condition might identify insomnia or GI issues as their primary symptoms. So in this case, when we look at primary condition, you see that mental health and pain conditions account for almost 80% of patients across Canada. And so what we really see is that pain and mental health are kind of a knot. And patients with long-term pain conditions sometimes develop mental health conditions as a comorbidity. And the inverse is often true, that patients with long-term mental health conditions sometimes develop chronic pain as well as comorbidity. Come on. There we go. With primary symptoms, you get a much better breakout of who's using medical cannabis and how. So once again, you see chronic pain as the primary symptom cited by patients at about 60% or 56.8%. But then that's closely followed by anxiety, insomnia, stress, depression, and then headaches. So the top 6 conditions encompass pain and mental health. So although there's a presupposition that patients should not be using cannabis for mental health conditions, and it is true that patients with psychosis or schizophrenia are a vulnerable population, you see that in Canada, patients overwhelmingly cite mental health as one of the main reasons they're using medical cannabis. And of course, that's one of the reasons at Tilray that we're studying PTSD as well. Now, you also see a lot of use for appetite loss and nausea, sometimes to do with cancer chemotherapy or Hep C treatment or HIV/AIDS treatment. You see a lot of use for spasms like Parkinsonian conditions, MS, epilepsy, and also gastrointestinal disorders like Crohn's, colitis, IBS, IBD. These are some of the primary reasons why patients cite using medical cannabis across Canada. And yet, when you look at the Métis First Nations patients, they are statistically much more likely to cite mental health conditions like anxiety, stress, and depression as primary symptoms. This is a distinguishing characteristic of this cohort, that although you still see a lot of pain, you see a lot more anxiety, stress, depression, and insomnia. And I have no doubt that that's a post-colonial or current colonial response that's happening right now when we see this higher prevalence within First Nations and Métis populations. In terms of cannabis use per day, 74.6% of patients use cannabis daily. Now, pain and mental health are daily chronic conditions, and they have daily chronic pharmaceutical treatments, so it should be no surprise that these same patients are using medical cannabis on a daily basis. And the average use, in terms of the amount used, is about 1.5 grams per day. And that's very consistent with research that's taken place in Europe and the US and Australia and Canada that suggests most medical cannabis patients who are using flower cannabis use between 0.5 and 1.5 grams per day. In terms of primary method of use, this was really exciting when I did this survey, because it's the first survey I've ever done where vaporization beat out smoking is the primary method of use. And I've got a newer study, the top study that I alluded to earlier, where we actually see extracts as the primary method of use. So what we're seeing is this significant shift away from the smoking of high THC products that dominated the Health Canada program for its first 15 years of existence towards vaporized or alternatives to smoking like oral ingestion, oils, drops, capsules, of higher CBD product. That's where the current trends are heading as people move away from smoking high THC product. My primary area of research, both at Tilray and I'm also a researcher with the Canadian Institute of Substance Use Research, is looking at where the cannabis is used both consciously and sometimes unconsciously as a substitute for opioids and prescription drugs, as well as alcohol, tobacco, and illicit substances. So the next few slides are going to look at a phenomenon called cannabis substitution effect, which identifies that. So when I do this kind of survey, I always ask patients, have you ever substituted cannabis for any of these four classes of drugs? Prescription drugs, alcohol, tobacco, or illicit substances. Now, these are medical cannabis patients, so maybe you would expect to see some substitution for prescription drugs, but I find it fascinating that just by introducing medical cannabis in their course of care, 44% of patients say they cut down on their alcohol use. In some cases, they gave it up altogether. 31% of patients say they cut down or gave up their use of tobacco, and 26% of patients who'd previously used illicit substances say they cut down or stopped their use of illicit substances. And in fact, we skipped over one. And in fact, when you look specifically at opioids, of the 458 patients who report substituting cannabis for a total of 610 opioid medications, a full 60% of those opioids, they say they stopped using altogether. So it's hard to look at data like this without thinking that medical cannabis isn't playing a role in reducing the impact of opioids on patient health and on public health as a whole. Now, I'm not the only researcher who's found that medical cannabis can be Is someone messing with me? Are you messing with me? There we go. So I'm not the only researcher who's found that medical cannabis can be used as a substitute for opioids. In the US, where half the states have medical cannabis programs and half do not, Backhuber and all found that in those medical cannabis states, there was a 25% reduction in opioid overdose deaths compared to neighboring states that did not have a medical cannabis program in place. And the longer the medical cannabis program was in place, the greater the effect size. More recently, when Bradford and Bradford found that in medical cannabis states, prescriptions of opioids were declined by 12% following the introduction of medical cannabis programs. And even here in Canada, where Veterans Affairs Canada and the federal government has made kind of a big deal about the number of veterans who are increasingly using medical cannabis as a treatment for PTSD, pain, and other conditions, during that same period that we have seen a rapid increase in vets using medical cannabis, we've seen a 43% decrease in the number of vets using benzodiazepines and a 31% decrease in the number of vets using opioids. So this data seems to be playing out across a number of different patient groups, a number of different jurisdictions. And when it comes to alcohol, of the 513 respondents who substituted cannabis for alcohol, a full 31% say they stopped using alcohol completely, and a further 36.8% say they gave up alcohol or reduced their alcohol use by at least 75%. Now, once again, this is on an ad hoc basis. When patients are starting to use medical cannabis, doctors are not telling them, cut down on your alcohol use. This is just patients finding that by introducing cannabis in their course of care, they're no longer drinking as much, or they're giving up alcohol altogether. They're finding that they don't need it. So really remarkable public health outcome. And when it comes to tobacco, of the 405 respondents who substituted cannabis for tobacco, 50% say they stopped using tobacco altogether. And this data is so interesting to me that I've actually got a separate publication that's under review right now just looking at the tobacco data, because ultimately I think that if we can reduce the impact of tobacco on public health, we can really make a dent on some of the cancer rates in Canada and around the world. And when it comes to the substitution for illicit drugs, cocaine is the most frequently substituted illicit drug, followed by psychedelics and non-prescription opioids. And a full 72% of those who substituted cannabis for illicit drugs say they gave them up completely. So really remarkable to see this kind of outcome as well. And I wanted to end my presentation by talking about some of the impacts of legalization. We don't know what the impacts of legalization are going to be in Canada. We did hear some good news today about a story that came out earlier this week that suggested that in the first month of legalization, we haven't seen an increase in cannabis-related impairment, which is really good news. But if we look to the US and we look south, we get to have a bit of a crystal ball, because in the US there's about 10 states that have legalized the adult recreational use of cannabis. So why don't we look over there and see the impacts that's had on public health, and that'll let us know what we might expect here in Canada. And the first thing, of course, is that opioid deaths decreased, as I shared earlier. But even almost as remarkable is that alcohol-related automobile fatalities declined. Now, it's worth mentioning that when you introduce medical or recreational use of cannabis in any community, there seems to be a decline in alcohol use. Alcohol is the most criminogenic substance known to man. It leads to more crime, violent crime, homicides, domestic violence, more property damage than all the illicit drugs combined. So if you even have a small percentage of Canadian population on any given night choose cannabis instead of alcohol, or even use a little bit less alcohol because they're using cannabis, you tend to have a net benefit. And I'm not suggesting by any means that we want people smoking up and driving or getting on our roads, but objectively, the impairment associated with cannabis is much lesser than the impairment associated with alcohol. And unlike alcohol, cannabis does not increase risk-taking behavior, which is what alcohol does. And that's why it's such a problem when people get behind the wheel and they've been drinking. So in the US, they found that alcohol-related automobile fatalities declined, but they also found that violent crime and homicides declined just by legalizing the adult use of cannabis. They also saw that suicides declined because all too often, just like violent crime and homicides, Suicide is associated with alcohol use as well. So you reduce the use of alcohol and you reduce the level and rate of suicides. And maybe counterintuitively, they've also found that teen use decline. The reason for that is quite simple. If you take distribution of cannabis out of the black market, you put it in a store that's actually going to ask for ID, because street dealers don't typically ask for ID, you're actually going to reduce the level of teen use. And in fact, in Colorado, which is one of the most active, forward-thinking municipalities when it comes to cannabis use, their rates of teen use of cannabis right now are the lowest they've been since 1982. They're as low as they've been since Nancy Reagan told us to just say no. So the other impacts of cannabis legalization have been that Colorado now makes more on cannabis taxes than on alcohol taxes. This is the home of Coors. So this is a real disruption in the alcohol and the liquor industry. And on top of that, in 2015, the legal cannabis industry in Colorado created more than 18,000 full-time jobs and generated $2.4 billion in economic activity. So in closing, I just want to say that the opportunity presented by C-45, our Cannabis Act, the legalization of cannabis in Canada, is not only to reduce the harms associated with cannabis use by providing users with a safe, consistent supply and removing the profits from the black market, we also can maximize the benefits of cannabis use and its role in reducing alcohol, tobacco, and illicit substance use, as well as the use of pharmaceuticals like opioids. And so, in closing, here are a few final thoughts. I think there are many ways that Métis and First Nations could benefit from the legalization and regulation of cannabis for medical and personal reasons. Therapeutically, they can benefit. Economically, and also socially. However, there remain, as we've discussed today and as was discussed yesterday, significant obstacles to access to both cannabis itself and to the burgeoning cannabis industry. Métis First Nation patients should never have to worry about access to medical cannabis due to affordability issues. First Nation Métis population should not have to pay for cannabis in Canada. It should absolutely be covered through NIHB. And finally, Métis First Nation organizations could work with patients and allies to seek NIHB coverage.